other people join our webinar. So hello and welcome to you. Welcome to Self-Care in the Rise of the Pandemic, Part 2. This is about teaching mindfulness self-care at a distance. I am Ruth Cologne-Wagner, and I'm Director of Training and Development for NIAPRS. I'm joined today by Michael Ballister of our collective team. He is the Training and Technical Assistance Facilitator for the Hudson River region of New York, and that's all the way from the North Country through the Albany area, all the way down through Westchester and Rockland counties. So, and everything in between. So if you have any training needs, please feel free to contact him directly. I hope you were able to participate in part 1 last week. It was a smash. It was very funny, but it was also very informative. You can find a link to that actually on our NIAPRS website. You could also just go directly to our NIAPRS YouTube channel and find that and a lot more there. Before we move on, I do want to talk about that Michael and we're going to spend a lot of time talking today about what mindfulness is, the research, the applicability to our work, and then we're going to go into teaching it. How do you teach it? So in your role as teacher, with all the information that we share here with you today, use it. Use this information, all of it. There's nothing here that you can't share with the people that you work with. And another idea, even better yet, this is going to be recorded. You're going to be able to find it later on YouTube, and you can watch it with them or guide them to it or watch it. Wonderful. So before I go on, there are other issues I'd like to take care of, and those are the housekeeping issues. You are, if you haven't already noticed, you are muted upon entry. We ask that on your end, in case there's a glitch on our end, on your end, please also keep yourself muted. You should not be on camera right now with the way we set this up, but you never know. So sometimes you might see that you do have the feature to actually activate your camera. We ask you that you leave it off. And in addition to that, since there's 2 presenters here and one will not be speaking while the other is speaking, at least that's the way we've planned it, we never know, you might benefit from speaker view. And that's a little white box with 3 dots on top of it, and that should be at the top of your screen, and that's probably the best view for you. And then question and answers, that will be at the end. And we're going to ask you to please use the chat box. There are a lot of people in our virtual room, and so we want to be able to minimize any distractions. So please use the chat box for that. And of course, last but not least, everybody's waiting to hear about CEUs. We are offering 1 CE hour for today's webinar, and that is for social work, LMSW, LCSW, mental health counselors, LMHCs, and CPRPs, Certified Psychiatric Rehabilitation Counselors. So great, that will be 1 CE hour. Just by the very nature that you're in the room, that means that you registered for this workshop, so we have your attendance. And then at the end, we're going to be emailing you an evaluation. You do the evaluation. Those 2 things close the loop, and that makes you eligible for CEs. So please make sure that you submit that. The only thing that we ask is for some patience, because we're not many people in the office, and there are a lot of people on this webinar. And if you know NIAPRS, we're doing more than 1 webinar a week with 1,000 people at a given time. All right. So did we get to our bios yet, or this is the next one? Okay. Oh, so. All right, yeah, let's go back to NIAPRS. I didn't get an opportunity to say who we are.
Whoop, there we go.
All right. So if you know NIAPRS, you know this already, and I don't technically want to read this, but we're a change agent organization because we do so many things, and we're focused on improving the lives of the individuals who access care. And we also focus on public policies and social conditions. And so it's a various pronged approach to helping people. And we do this by advocating, educating, demonstrating, and innovating.
Okay. You want to
All
go
right.
to the
Yes,
bio?
please. Yes.
Yeah.
Thank you. All right. So that is me. And I am not going to read you all of that, but just know that I've been in the field for over 30 years. Once you hit 30, then you just say 30 plus, you say over, you don't want to keep going. But over 30 years in the helping field. And so I've done a lot of things from homeless services to employment services to foster care, behavioral health management, and then of course I moved directly into mental health care and managed several programs. And now I'm with NIAPRS as Director of Training and Development. And one of the things I do is provide oversight for the team, of which Michael is one, as well as do technical assistance. I'm very happy with this other part of my role. I'm able to do that around the nation. Okay, next. Michael Ballister, I'll just briefly introduce him.
Yeah.
He has also been in the field for 30 plus years. We won't get into exactly too much and how much of what, but he really comes to us with a wealth of experience, and he's been with us not for a very long time, but he's really one of the team, and he comes with us with experience in substance use as a counselor. He also has experience with mental health practice as well as with management. Okay, next slide, please. So this is a response to COVID, a loving response to COVID from NIAPRS. Every single day we offer everyone. It initially targeted the mental health workforce, you. But it's really open to everyone, and it's open to people receiving services, everyone. It's just 5 minutes. It's an actual mindfulness exercise that's done every weekday. We post it at 8 a.m. and it stays posted for 24 hours until the next one gets posted at 8 a.m. You can access all the ones that have already been done through our YouTube channel, and you'll just click on that link right there, the picture that'll take you to the mindfulness exercise for that day, and then just another link will send you to everything else. And I hope you take advantage of it for yourself, of course, for your own wellness, but also for the people that you work with. All right, next slide, please. And these are two of the many upcoming trainings. May 27th, we have Providing Employment Services in a Virtual World. Actually, Rob Statham and Len Statham are going to be facilitating that webinar, and actually have Rob. I didn't introduce him, and I'm sorry, Rob, but Rob is working for us in the background, and he's going to be helping us with the chat box. And then the next webinar after that for the collective is June 16th, and that's Empowerment in Crisis, providing skills to individuals in reclaiming their voice and making their choice. And that really is more about, all of us feel so many things are out of our control right now, and we're all sharing similar experiences. And what we're going to teach you there are ways in which people receiving services can gain some control in their lives. Next slide, please. So the learning objectives for today: identify aspects of mindfulness as a self-care strategy, become knowledgeable of the skills needed for you to teach and engage people in mindfulness as a self-care tool, and then to identify strategies for assisting people to engage in mindful self-care through traditional in-person or through telehealth means. Thank you. Next slide.
Yep.
Great, thank you. So mindfulness, as you know, has become almost like a buzzword, right? You hear it everywhere. That's because it's gaining widespread attention in our society, and has been for quite some time. Many people have different ideas of what it is and even how it can be practiced, and that's all good, because one of the things you're going to learn today is that it's all person-centered and what people are interested in practicing. So some people might, no, please stay with the previous slide.
Yep.
Some people might be intimidated or turned off by the concept of mindfulness because of whatever exposure they've had. Some people imagine people sitting in like a lotus position, straight on the floor, silently, in a state of bliss and enlightened for hours. I could never do that. Or maybe they picture someone in a challenging yoga position. And I definitely can't do that. What I use mindfulness for is as a stress reduction tool and to manage anxiety, overall anxiety. And it's very very helpful as well as you're working with others. So here's a definition of mindfulness from John Kabat-Zinn, and he's the researcher and creator of the mindfulness-based stress reduction. And it says, mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And in a sec, we're gonna say mindfulness is being in the now. And just look at how this definition says that. Mindfulness means paying attention in a particular way on purpose, in the present moment, and non-judgmentally. We're gonna touch on all of those. Okay, next slide, please. So I love this. Is your mind full, or are you mindful? So many of us are thinking of so many things. I mean, have you ever woken up and you're in the shower and you're thinking about work, or you're thinking about, you know, your appointments that day, you're thinking about maybe relationship issues. You're very rarely in the moment. Our minds, this is the way we are, we're human. Our minds are always full. And so we really should engage in practices, whatever that is, engage in something that would center us. And so, yes, I want to be mindful, but just look at this picture. I want to be mindful, but that does not mean my brain needs to be empty. All right, we'll talk about that in a moment. There is no destination for you to be where your brain has to be empty, but it is more of decluttering. And when you focus on the now, you're getting rid of the past that you're thinking about for that one moment, and you're not thinking about the future for that one moment because you're in the moment. You're being mindful. Next slide, please. So mindfulness has its roots in Eastern religious and spiritual traditions, you know, Buddhism, before Buddhism, Hinduism. So from east to west, it became a religious practice, and now it's a secular practice. Here, mostly in the West, is secular. One of the things that we always say, yet we did say, is person-centered. So as you're introducing mindfulness to individuals, it's important to be culturally sensitive. They might be a Buddhist, they might be Hindu, or they might just be spiritual and embrace a lot of those Eastern practices. So it's important to know people, but also important to give them options and to give them choice. So yoga has often been associated with mindfulness, as we said, but it's important to know that you can practice yoga and not be mindful. And you definitely don't need yoga to practice mindfulness. So they can be distinct, and you can combine them. It's you know, when you Google, in Google Images, you'll write mindfulness, and immediately you get pictures of people in yoga or lotus positions. And it's like, that is why we're so connected, that mindfulness has to be a certain way, but it doesn't. And we'll explain a little bit about why it doesn't have to be. Okay, next slide, please. So why is mindfulness important? Well, physiologically, there are a lot of benefits to our body. The brain structure, cardiovascular health, all that wonderful stuff there, I'd like to go through in a second. But it generally improves our overall health, which is why it's important to understand that mindfulness, yes, can be used secularly, because there are so many benefits to our own physical and emotional health. And it has a positive impact on our body. So let's look at the brain structures. There are positive changes in 8 brain regions, key to introspection, awareness, body awareness, memory, which is my favorite, self-control, emotion regulation is an important one for a lot of the people we work with, and communication, even physiological communication between the 2 brain hemispheres. Now, in terms of cardiovascular health, it's connected to having a healthier heart and healthier lungs. Immune functioning, there's a reduction of markers of inflammation correlated to decreased immune functioning disease. Sorry, I had to read that very specifically because I didn't quite understand the language there. But essentially, there's activity that stabilizes the chromosomes, and it prevents deterioration of the immune system. And then in practices of trauma-informed care, right? It shows to be useful for problems commonly seen in trauma survivors, such as anxiety or even hyperarousal. Research also shows us, in terms of the positive changes and the positive feelings, they show us that the only way change can really happen is by being aware of our inner experiences and learning to befriend what's going on inside of us. So there's a whole mind-body holistic approach that's greatly beneficial when you practice mindfulness, especially mindfulness for people who are healing from trauma. Next slide, please. So with all that wonderful information, it's a no-brainer. Mindfulness is so powerful that the fact that it comes out of Buddhism is irrelevant. And that's John Kabat-Zinn again. And we emphasize this because some people may be put off, because I was one of those persons that was very put off by the whole thing. And it was a former person that I supervised who also is an amazing person in general. She taught me about mindfulness, and I said, I don't believe in all that mumbo jumbo. And now I'm a convert. I got my aha moment when it came to mindfulness. And I said to her, you put together a training for us, but you need to convince me. And she did. Yes, I mean, she convinced me so much that I'm now every single morning doing the mindfulness exercise for NIAPers. So can we introduce mindfulness in a way that isn't met with resistance from the people that we work with, or, you know, for them to associate it with religion? And so let's take mindfulness out of its spiritual context. It may be undesirable. You just got to remember that too. It may be undesirable for us to take it out of the religious context, because that might be insulting for some people. But for other people, separating mindfulness, the spiritual part of it, might be really what encourages them to practice mindfulness, so that it's not connected to something that's out of their own belief system. But it can be part of their mental wellness toolkit, right? The same way it's part of our toolkit. So bringing about overall wellness and health and a positive well-being result. Next slide, please. So it's important for us to remember, yes, person-centered. We're going to keep saying that, but we'll say it in different contexts because it's just very important. So get to know the people that you work with, yes, but give them options. And you can take an example of a devout Christian who may connect with the wellness part of mindfulness, but not the rest. And that's okay. And that person is me, and I'm not alone in there. And I love mindfulness. And my whole family, whenever they see me sort of stressed out, whether it's work or whatever, be mindful, you know, and it really does. It does give you a sense of, whoa, stop, look, listen moment. So I really like that in the way I've incorporated it into my life. So give them options. Don't just say, oh, they're not gonna be interested in this. And then non-judgmental. Essentially, that means don't judge yourself. Remember before in that other cartoon picture, you had a person with their mind full of stuff, and then you had the other person with it empty. So it's important for me to share with you, your mind does not have to be empty. It's not like you don't have to be thinking about anything. We want you to be focused on things, and that's fine. But if your mind wanders, don't judge yourself. It's okay. We're all students of mindfulness, and it's a lifelong practice. And that's exactly what it is, a practice. And then lastly, take a beginner's mind. I said I'm a lifelong student. Yeah, there's always things that I can learn, and not just learn about the practice, but I also grow and change. And so I always take that beginner's mind. Okay, next slide, please.
Okay. And I think it's my turn.
No, I still have this one. It's okay. You've got the next one.
No problem.
Don't take this one away from me.
All right, no, you got it.
This is my favorite. Be here now. And so when you practice mindfulness, you are cultivating awareness. Eckhart Tolle wrote two books, The Power of Now. Actually, I think I have that back there if you look at my bookcase, and A New Earth that I actually don't have. I probably need to buy that. But when you cultivate awareness, you actually become somewhat of an observer of yourself. And this allows you to separate your thinking from your observations, right? So this is nothing new. The concept of re-examining thoughts, mindfulness didn't make this up. We do this in our clinical practices, in CBT, in DBT, in acceptance and commitment therapy. And then there's mindfulness-based CBT and just etc. There are other clinical practices that actually do the cultivating awareness. So mindfulness allows you to experience the now. And if you have the opportunity, go to YouTube and look up Eckhart Tolle and Oprah Winfrey. And you will see a wonderful clip about them talking about the now. We wanted to incorporate it, but the quality was not good. So many of us turn, when we're trying to cultivate awareness, many of us turn in our minds to the past. Some of that might be happiness, some of that might be regret, or our minds are focused on the future of hope or even fear, right? We all know what those are. So when you do this, you miss the now, you miss this one moment. And this one moment will never return. So we want you to use mindfulness exercises to help us appreciate the now and to make the now the best it can be, and through its many benefits, not just spiritual, right? Not just for stress reduction, but also for the positive physiological changes that it has. When we concentrate, cultivate awareness, and focus on the now, we're going to help you focus on the now in an exercise in a little bit. All right, now I'm going to pass the baton to you, Michael.
Okay, thank you so much. And this is a great concept, and it's really important. But as we talk about it, to keep this concept in mind, but again, when Ruth talked about being person-centered, and that not only is the practice person-centered, but how you introduce it really should be person-centered. So what do you need to introduce mindfulness to the people you work with, whether they're sitting in front of you or you're talking on the phone or even on a video monitor? What kind of things help with this process? The first is knowledge about what mindfulness is. It's really important that you have an understanding about the background of it a little bit. You don't have to be an expert. You teach what you know, but understanding that it really does have positive impact on health. And we're talking about mental health and physical health. So that you know a little bit about the research, know a little bit about the background, and that will give you some tools in order how to present it to the person you're working with. Because hopefully you'll know that person. This won't be the first meeting with them, and many of you work with a lot of people for a long time, and just using your knowledge and understanding of them as well as mindfulness and practicing mindfulness, find what works really well. Now, the next one, self-practice is ideal, and there's a however in that. We talked about this too. And a lot of places talks about, well, you have to do it. And other people said, well, you don't necessarily have to do it, but. And the but part is that you need the knowledge. You need the understanding. And then if you practice it, personally, I do. It's helped me personally during this present crisis. It also helped me during life changes that have happened to me. And I have not been practicing it very long. In some ways, at least formally, but certainly informally, I recognize things that I've done that are mindful. And that's the other thing. You need to be open and understanding that mindfulness is not a written script. Mindfulness is not, you have to do it this way. You have to stay in that box. It is something that you really can expand your creativity and your mind around the process. That you need to be open to everything. You're going to get people that are going to be skeptical. You're going to get people, and I work with people. Ruth won, she was skeptical, and I'm so glad she talks about that because they think that's important. I've got other staff members and people I work with that, nah, it's not for them. And that's okay. Everything doesn't work for everybody, but we need to be open and see what we can do, because the toolkits we can use to help people, the more tools we have in that, the better we can work with folks. So the mumbo jumbo, and I just heard that recently. I'm not sure where, but you know, you're going to get some of this response. Isn't it some kind of religion? I don't believe in this mumbo jumbo. And there are things that you really can address that. And you know, here's some basic scripts, and I do want to mention that the slides will be available after the presentation. You'll be able to go to our website and we'll have that available for you. So I know some people were asking about that. But so if you hear from somebody you're working with that they don't believe in it, isn't it some kind of religion, talk to them about, it did start as a spiritual practice, but because of all the scientific research and benefits, it's really grown. And much like things like yoga, and yoga did start as a spiritual practice, but it came to the States in a secular and was presented that way. And it can be secular now. And certainly the trainings that I've participated in and what we do at that secular piece is really important. It's also used by sport teams, by businesses. I just saw an email today from an organization that's doing a mindful MBA degree. So it's out there, it's all over the place. And you can encourage people, because there is so much information out there, they can do their own research about mindfulness. They can find out about it, see what works, who they might know, whether it's a sports person, a musician, an actor, someone is out there, they're using that mindfulness. And you can provide, talk about the scientific research, the benefits of just the exercises. You don't have to do everything. You don't have to sit and do it. So there's a lot of ways to do that. And if, as Ruth said, if someone's involved in a faith-based or spiritual, we do all of those things. A lot of people, most religions engage in activities that are mindful, where they're focusing on the moment, where they're praying or meditating or dancing or singing. All those things can be seen as mindful, and open up the definition to it for people and allow them to find their path. And, talk about what they're doing now that helps them with their feelings, and, taking a walk, sitting in a park, praying or singing. Well, all those things can be mindful. And it's a way really to exercise our mind and learn how to strengthen those things that make us feel better. So what we're offering to people is improving some of those skills that they can, that they're already using if they're involved in some of those things. Your goal is helping those people to find their practice. Not, I'm going to show you how you have to do it, but let's go through some ways that we can try and examine that. And right now I'm talking about, specifically we're talking about mindful. And I know on the chat box and other times I've presented some of this information, people are asking, well, how do I get them to get that whole aspect of being the here and now? Well, that's a very critical part of mindfulness, but it's not necessary to engage in the practice of mindfulness. So finding people's practice is finding how they can relate to what you're working with. Rather than us kind of getting them to buy into our concept or the concept about mindfulness, we want to get people to develop their own concept about mindfulness. So some of the foundations for practice, and that's actually John Kabat-Zinn behind there, but these also include other ones that were added on. There's the Mindful Yoga Academy added the Do Not Harm, the Ahizma, and then the Foundation of Compassion added self-compassion to this. But I think the most three core foundational attitudes is non-judgment, is patience, and a beginner's mind. And I know Ruth talked about these, but I do want to stress that non-judgment, not only for how people are practicing, what's happening during their practicing, but as an instructor, as a teacher, as a counselor, therapist, don't necessarily judge people. If somebody says, I think it's hooey, I said, okay, well, I understand that. There's things I think that's hooey, I still throw this salt over my shoulder when I spill some. So, the patience is really important. We need to allow patience for people to begin that process, to learn and to exercise those muscles. But patience as with people working with them, it's like, well, that's not going to work. Okay, but come back later on with it. And the beginner's mind, a really important concept. And that has a lot to do with the focusing on the moment, because every moment is new. And every thought that happens in this moment is a new thought for this moment. But recognize those things as important, as well as the other ones: trust, non-striving, acceptance, letting go, or I like to say letting be, and his own self-compassion. So all those things, think about those things if you're going to be presenting the concept, understand those processes. And the two most important basic rules, I mean, if you can, if you're going to be practicing mindfulness, and I love that it's practicing mindfulness, whether it's someone that started today or yesterday, or somebody like John Kabat-Zinn who's been doing it and developed the mindfulness-based stress reduction, they all practice mindfulness because it's a practice. Each time is new, so we're starting new. So focus your mind on the present. So that's the first concept. No matter how you do the practice, is focusing the mind on the present. Now, the present is a concept. So we do use things like focusing people on their breath, or focusing on what they're feeling in the moment. Or if you ground them, what does it feel like sitting in this chair? What is it like for me with my feet on the ground? Focusing on what's happening in the moment allows people to focus their mind on the present. So balance that with people. Well, we got to focus on the present, and all these thoughts come in, and we'll talk about that, but they're going to be trying to get the concept, and it's not a concept. So once you notice your attention, and once you notice that your attention has wandered, and once, because everybody's mind wanders. There's a study, and I'll mention it now and maybe again later, but they did a study, and 50% of the time our mind is wandering. That's the human mind. It's built that way. We evolved this way, so it's going to wander. So when it wanders, notice it and gently bring yourself back to the present moment. Bring yourself back to your breath, or how things are feeling, or what's going on in the moment. So those are really, really important concepts for that. So you can do a formal practice, a traditional meditation, setting aside to do that on a regular basis, do nothing but meditate. A minute is meditation. It could be hours long. Some people do that. I couldn't do that for hours long. You can sit, you can stand, you can walk, you can lie down, you can swim, you can fold clothes. Oh, let me back up with that. Because a formal practice is that this is what I'm going to do. I'm going to focus on that. And if that's where you start with, folks, that may be an issue, because that's difficult to do. Now, I think it was Eckhart Tolle that said, mindfulness meditation is nothing. It starts with one breath in and one breath out. That's all it takes. If people can do that, and if you start with folks, just and talk about that moment, that's mindfulness, that's meditation. In formal practice, you apply the concepts of mindfulness or compassion to something you're already doing in normal life. I was folding clothes this morning. Or even just buttoning my shirt. And I just slowed down, took a couple breaths, and just as I was buttoning my shirt, the difference between how hard the buttons were versus how soft the cloth was. And just as I manipulated my fingers to button my shirt, that's practice. And that's mindfulness. And those are the kind of things I'm talking about when you're trying to introduce with people, whether they have, some anxiety, or they just want to improve some things, or if they're dealing with a serious mental illness. And so all those things, you want to balance that. And you want people to become aware of the thoughts and the feelings. What were my thoughts and the feelings as I was doing that? I was enjoying just taking the moment. I was enjoying the relaxation of it, and I was happy that I could take that moment to do that. So all those things are ways that you can work with people to practice mindfulness. Forget formal, informal. We should erase those from that. Any practice is practice, and anything will help. So if you're going to guide people through meditation, there's lots of ways to do that. And this talks about doing a script. So if you have a mindfulness script, and there's a lot out there, there's a lot of free ones out there for folks, and you can make up your own that are specific to the person. But if you're going to be doing a guided meditation with someone, take your time to choose the right one that matches the person you're working with. or adapt it, edit it. If you see my mindfulness scripts, when I do that, or when I read, and I've been a guest for Ruth on her mindfulness in the morning a couple times, you know, I scratch things, I make things different, I change that, make it yours so it fits the moment. You want to create, you want to read that script a few times in advance. Don't just read it off the cuff, and don't make it cold. Because as we talk, and give yourself, practice mindfulness as you're doing it. You're going to skip words, you're going to make a mistake, you're going to add something different. That's okay. You want to create a comfortable environment for the person. And I know distance-wise, that may be difficult for some people, but that comfort can come into how you connect with people. You know, and how you connect with people before and after. If you only meet with them for a half hour or 45 minutes on a video screen, it's going to be really tough to do that. If you have a connection with people, if you interact with them in different ways, and we'll touch on some of those, but that comfort, that a degree of comfortableness is more environment if they're in the office, but the environment is the connection with people. Practice what you preach. As you're reading the meditation and reminding people to be mindful while you're reading that meditation. You know, don't skip, and don't, you know, start over again, and don't, just go with the flow and talk about your feelings and breathing when you're doing it, and so on. And slowly and clearly, taking longer pauses where necessary, and adding pauses when you think it's important. No matter how you connect with people, we need to look at what's the goal of teaching self-care. And that means about increasing the resilience of people, our ability to manage our emotions, our ability to deal with the crisis that we're dealing with right now. We're all dealing with our resilience right now. And however you manage that now, if that's working, great, do it. Don't stop. Do it more if you can. And add something to it if you'd like. Try mindfulness meditation. And that's what we're talking about. This is not an end-all be-all. This doesn't mean you stop everything else. It means you add this to your toolkit. We want to empower the people we work with. Empower them to be able to take care of themselves. Empower them to see that they can change. They can change their thoughts. They can change their feelings. They can really grow and build using this toolkit. We want them to develop and maintain a healthy relationship with themselves. Unless they live in that program, you're not going to see them every day. You're not going to see and even if you work there, you usually don't see them every day. And even if it's outpatient or you see them distantly, you don't see them. You see them for an hour, and how many hours and how many days are out there. If we can help people to build their resilience, if we can empower them to learn and use tools that help them, if you can help them to develop a positive self-relationship, self-compassion, all those things are going to connect and grow and build and help that person move along the continuum. So Ruth is going to come on and do a mindfulness exercise for us, and a mindfulness breathing meditation. So Ruth, are you ready?
Yes, I'm ready. So yes, you see me on camera. I'm actually going to get off camera. And Michael, if you don't mind getting off camera too. Sure. I don't want anything to distract from this exercise. All right. So as long as you can hear my voice, we're all good. So I'm going to run us all through a breathing meditation practice. And so this is for you. I'm going to take a moment because I want you to take a moment. Find yourself a comfortable seated position. I want you to sit back into your chair and just find that comfy spot. If you're comfortable with this, please also close your eyes. As they close, take an intentional breath in and out. Find comfort in the darkness behind your eyes and focus your thoughts on your breathing and observe. With intentional effort, let's manage our breathing. It's our tool here that will focus and center us to spend time in this one moment. Breathe in through your nose and out through your mouth. Do this with intention, but at your own level of comfort. Focus on the feeling of your breath, filling your lungs, and as your breath out through your mouth, notice how your body sinks just a little deeper into your chair, grounding you to this earth. Your mind may wander, but that's okay. Don't judge yourself too harshly. This is natural. Let's just take the moment to notice when our mind wanders to the past or the future, and bring your attention back to your breath and how relaxed you feel in the present moment. Allow yourself this comfort. As you continue to breathe, redirect your attention to your neck and shoulders. You may notice some tension there. Let's work on letting that go. Rotate your shoulders in a circular motion, forwards or backwards, it's up to you. As you breathe in through your nose, rotate your shoulders up and then rotate them down, gently releasing your breath through your mouth. Let the release of your breath and the downward movement of your shoulders pull you deeper and deeper into your chair as the tension dissipates. Again. As if floating above yourself, observe the tension floating away from you and into the sky, away from you. Breathe in and feel your lungs expand. Breathe out and feel comfort. Your mind is calm. You are in the moment. When ready, slowly open your eyes and be glad. A moment in time is precious, and you found it. Thank you, everyone. You know, our breath is a mindfulness tool that we always have available to us when needed and wherever needed. Give yourself a few minutes to use your breath to recenter yourself. You are always in control of that. If you're interested in joining me as my guest at Start Your Workday Mindfully, a daily Nappers 5-minute retreat, I would love to have you. All you need to do is to email me at rucruth, I can't spell my name. That's how calm I am. I'm going to put it in the chat box. ruthcw@nayappers.org. All right, there you go. I'm too relaxed now. I hope everyone is relaxed. Are you guys?
Yeah, Ruth, that was
it helpful?
Yeah.
I want to know if it was helpful, guys. Let me know.
Very good. Yeah.
Oh, good. I'm glad. That worked really good, even for me.
The dangers and the benefits of taking a moment.
Yes, yeah, be careful when you're driving, please. No heavy equipment.
Hopefully nobody's swerved over in the car. We should have warned people.
Yeah.
Here's, you know, the great advantage of this, and there's a couple things I want to mention, is that if you practice in even reading a script with somebody and working them through the mindfulness, you are experiencing the same thing they are. So the benefit of engaging in this practice as a provider is that you're actually giving yourself all those benefits and you're sharing that with people. And, you know, some people, they want to have some control and they feel, which is great, give them the control. Have them write their own mindfulness meditation. And one thing that Ruth mentioned, and letting people know that this is available for, I also encourage you, for anybody that you work with, they can go on this and do that. And we've got at least a month and a half worth on here of all different meditations, very short, very focused. But you notice, much like the one that Ruth just did, it wasn't specific about you as a provider or you as a therapist or you as it was you. That the universality of mindfulness is what drew me to it, that anybody can do it and everybody can benefit from it. So people are going to have questions that you work with. They're going to want to know, how do I do this? They're going to come up with a lot of different ones. So we've come up with, and again, you'll be able to see get these slides later on, but there's a couple things. So if the number one thing I think for myself and everybody else is that it's hard to make the time. So, you can say to them, of course it is. Starting something can be hard if you've never done it before. It's terrific. So what you can do is, give them worksheets, help them set up a schedule, find out if they've ever done something that was really hard in the beginning, but later on became a habit. We all, most of us, and I shouldn't say all, but, ever ride a bicycle? Remember the first time? I remember one time I would go around the neighborhood and I would fall down in front of the same house each time, and there were people in their garage, and I'd go back and I'd do it again. And we all do, when we start something new, it's difficult. But think about an Olympian that won the gold medal in weightlifting. Do you think that person started off lifting almost a ton of, 1,000 pounds, 2,000 pounds? I think the record's close to a ton. Is that, no, of course not. They built up to that. They build their muscles up. And that's what mindfulness practice is building your mind up. Start small. A minute, 5 minutes a day can show results. Set up let's try it for 1 week or a few days, and just do it at the same time in the same place each day. Or, and how they engage in that process. And there's different examples of this. If they need a lot of stimulation, if they need sound, if they're one of those people that, thrives on that, so do it with music, or do it with a mantra, or do it with them walking outside and being active. It's just focusing on the moment. And the moment for people in the beginning needs to be breath. It needs to be you're walking and you feeling your feet moving on the ground, and the smells in the air, and how you're feeling inside just at the moment. All those things are a way to practice mindfulness. Some people say every time they try it and they feel overwhelmed. And certainly people that deal with trauma, to people that are dealing with, some severe diagnoses. So you start slow. And you start minimal, and you give them options. Ruth talked about, if you're comfortable, close your eyes. Well, you don't have to close your eyes. Sometimes for people with trauma, focusing in on an internal focus, whether that's their breath or how they're feeling or their shoulders, that could be trauma triggering. So have them develop a research. Think about a pleasant experience. When was the last time you were happy? What moment can you think of? For me, that moment is seeing my sons at their birth, when they were wrapped up and handed to me, and everything melted away except what I was looking at that moment. My child, this person, brand new to the world, and everything melted away. And I can think about that moment and experience those feelings again. That could be my grounding moment. I'm not necessarily thinking about the past. I'm bringing that memory into the present and talking about how it affects me. So we need to get people to do things, do a brief exercise. We did a very short one. You can do even shorter ones. Just, get somebody, when you naturally breathe in, your shoulders go up, your stomach expands, your chest expands. And when you breathe out, everything relaxes. And that's where you talk to them. You just did that. Can you feel how much different how much different do you feel from when you did it to now? And that can be an aha moment for people. Finding those things is really, really important. So, how do you engage people remotely? You need to use every means necessary, not the best one. You need to engage them in every level you can. You need to check in with them. And again, there's a long list here. Check in with people who struggle with technology. Send them links about, games they can play on their computers, cognitive games. Give them links to, apps that are on their phone. I use a couple different mindfulness apps. They're great meditations. There's a lot of free ones out there. There's a lot of ones, some that you have to pay for, but all those things can help. And, there's a lot of YouTube videos on it, and Ruth just gave you a really good example of one of hers, and there's more on our website, and there's more out there. Even watching simple videos there's a great one which we didn't have time for, and it is in the resources at the end of this and references. There's a friend of mine that does it. Her name is Coco B, and she does these marvelous watercolor paintings, and it's a whole mindful experience. And frankly, I would just watch it because of that. I'd breathe, I'd watch it, think about how beautiful it was. That's a mindful experience. All those things happen, and all those things are available. Make sure you've got a good support network for folks as far as how you connect with them. Zoom, group conferences, FaceTime calls, messaging. There's Facebook rooms now. Or if you've got one of the HIPAA compliant medical connection ones, use those. But, connect with them, send them mail, send them things on texting. That you can just send people a link to a good meditation exercise on a text. There's no personal medical information involved with those things. Positive affirmations. Now, Ruth kind of threw one in hers at the end, and using those work effectively and developing them for the people, having them develop, what are you good at? What are you successful on? Or just letting people know that you are successful. You're here today, you came in, that's a success story. Finding those little steps to go bigger and bigger and bigger with people. But even a little step gives people a long, long way to get them moving forward. A few minutes a day, doing a breathing, and you don't have to call it mindfulness, folks. You don't have to even bring it up. Say, there's an exercise. It's just about breathing. Let's try that and see how you feel. It is just a way to get them to focus differently. We're trying to, people get distracted about the past and their worries about that, or they get distracted about their future and what's going to happen. So distract them from those distractions by what's going on at the moment. Wow, that shirt feels wonderful. How does that feel to you? Does that bring up any feelings? Or, that's how you get people focused in on the moment. Be creative, be person-centered. You can do this. All of you are doing this now. When my son was a little baby, and he had colic, I'd come home in the early afternoon, we'd sit down, turn on the music, and I'd just sit on the floor and rock with him and listen to the music. I was practicing mindfulness with my son even before I knew what mindfulness was about. It works with everybody. It works with old, young, geriatric, seniors, juniors, mental health patients, disability. Doesn't matter. Work within those things. And remember that, skepticism is natural and healthy. It may limit you in some ways, but it's somebody that has a strong mind. So shift that misunderstanding. We talked about the spiritual and religious aspect of it. Bring it forward if it's important. Let it go if it's not. Shift to exercises. Don't talk about we're going to be practicing mindfulness. Here's an exercise. It just asks you to think about what's going on at the moment. Adaptability, person-centered, relax with it. If you're going to be presenting this, be as person-centered, relaxed, and normalize it. We did a breathing one today. We don't need to learn how to breathe. We all know how to do that. We're just kind of doing it in a different way. As I said, we've got a long list of resources in here of the facts about the benefits of it and some of the things we've talked about today. So you'll be able to see that when you take a look at the slides. And before I close up, I want to just mention this. Pema Chödrön is a Buddhist nun. She's actually a teacher who grew up in the western part of the United States, but she became a Buddhist nun and she wrote a lot of popular books, you know. But this statement, "You are the sky, everything else is just weather." So our minds are like the sky. And the clouds come by, the clouds about the past, the clouds about the future, our clouds about the feelings. They're gonna fly but go by if we let them. Or when I get really stressed, I'll take a deep breath and I'll literally go and try and blow them away and just focus in on the moment. And she actually started the first Tibetan monastery for the Westerners, and it's in Nova Scotia. So she's a wonderful person, and I think this is a wonderful way to do that. So I want to open it up, and Ruth and Rob, if there's any questions that people brought up.
Yes, please type in your questions. Nothing so far, just wonderful accolades, Michael. I'm so glad everyone enjoyed this.
You know, I did see someone mention that, you know, could we come to their agency to do that?
Yes.
That's our job. And, you know, right now we are doing these webinars as well as, we do trainings for programs. We're doing that online because that's the safest thing we can do right now. But we normally do this in person at people's agencies, and we have, you know, the other trainers and facilitators that work with us. We've got somebody down in New York City and Long Island. We've got Rob, who helped with this on Western New York. And so we can come, and I'm covering up and down the eastern part of New York State. So we'll be glad to set this up. Give us a call, email us, and we'll work with you on that.
We have one question, Michael,
yes. Yeah.
From Maria Teresa. Can this be helpful with patients with dementia?
Absolutely, it can be, and you need to make sure you address it person-centered with them as far as their ability. But it's actually showed. I know there's a lot of research that helps prevent and delay dementia, and I'm hoping that would work. But even just spending that time with a moment, getting them to focus with that is going to help them. Because certainly with dementia, you know, those moments of the present gets really difficult. But if you can connect with them and find out what's working, what works for them. It may not be a breath. Maybe it's physical contact. Maybe it's something soft or a cloth or something like that. So try different ways to engage people in that process and just talk to them about what that experience is like in the moment rather than talking about, you know, be present. So,
another question here, Ruth.
Go ahead. Thank you, Rob.
If our clients suffer from schizophrenia or anxiety, do you have any particular suggestions?
So, you know, especially during this time with anxiety, it helps me with my own anxiety.
It would, you know, to take it at their own pace, and you never want to lie to people. Say, oh, you know, oh no, this has nothing to do with religion. You say, no, some people believe in this, other people believe in this, but you know, let's do something easy together. Let's just breathe.
Right.
Yes, people can do that. And so when they're focusing on their breath, that in and of itself, it's the direct focusing, the direct intentional motion and thoughts of focusing on your breath. That's mindfulness. Right. And the breath, the reason we're always talking about the breath is because that's an internal tool that we have. We can't get away from, well, I guess we could when we pass away, but then we'll no longer be needing mindfulness. Sorry about that, guys. Listen, it's time to stop. I love this. I appreciate you all so much. If you'd like additional trainings, please reach out to us directly. You can reach out to Michael Ballister at Michael B. The addresses are right there, or to myself, and we'll make sure to connect you with the proper trainer for your region, as well as send you a brochure of everything that we can do. And we do Zoom webinars now with you. I'll be doing them in person, hopefully very, very soon again. So all of our love to you. I hope you all are wonderful, are calm. Thank you for your feedback. You've been amazing.
Yeah, absolutely.
Thank
Thank
you.
you so much. And
Take
thank you
care.
for everything that you're doing.
Absolutely. Thank you.